Hello, everybody. Welcome to this very special edition of Human Condition MD. We have a celebrity physician with us today, Dr. Ali Seifi. Now, Dr. Seifi, tell us your name, where you are now, and what we are going to discuss today.
Hi, everybody. My name is Ali Seifi. I'm a neurointensivist. I'm associate professor of neurosurgery and neurocritical care at the University of Texas in San Antonio. And I've been here for about 10 years as a faculty physician.
Amazing. Now, Dr. Seifi, many people don't know this, but they've heard of the device. Now, it's an amazing device. It's called Hickaway. Many people don't know that you are actually the inventor. Not only are you a physician, not only are you an amazing teacher, but you're now actually an inventor. So people have seen this device omnipresent across many news channels, across the internet, across America, Europe. It's really worldwide. Tell us, how did you come up with the invention of Hickaway?
It's a very great question, actually. I would say a few years ago, I was seeing patients in neuro ICU. These are the patients that they had brain surgery. And one day I saw a patient that had brain surgery, and the day after, the patient had hiccups. And as I entered the room, I found like the patient had about like tens of cups of water on his table, and he keeps drinking this upside down, the other side, and he was very frustrated. And he turned to me, he said, "Doctor, you guys don't have anything for hiccups?" So at that point, I was thinking myself, it's a very good question by that patient that, this is like, we have treatment for anything you name it. We open the brain, we do brain surgery, we have cancer treatments, we have, we can, treat everything, but not such a simple thing as hiccups. And then I was just searching, and I found like hiccups actually is the third most common Googled medical term in the world. So if you go to the Forbes magazine, you can see all the people are searching how to stop hiccups. So it was a very common thing. And then at that point, I said, you know what about if I come up with the idea of make something to cure hiccups?
That's an amazing story. And what's even more fascinating to me is this is not just something you invented because you saw a patient. There's even a family connection in there, right? And it involves a story with actually your son and maybe a popular fast food chain.
Yes. So the story is that, so when I had that patient, and then I started to make some prototypes, so I started to research and study, so what are the ways to stop the hiccups? And then I started to make several plastic prototypes with 3D printers and different types. And one day after I had a couple of these prototypes, I was watching my son that he was using one of his McFlurry spoon to eat milkshake. And I found like he is using that straw, and he is just trying to sip that milkshake. And because the milkshake is kind of thick, he had difficulty to sip it. And then I take a look at that McFlurry, and I said, okay, that is also something somehow similar to the prototype that I'm making. So that was like a coincidence, and it was interesting.
Now, from the Golden Arches, you never know where you'll get your inspiration, whether it be a family member or McDonald's. But in all seriousness now, I know you've been on NBC and Popular Mechanics, Insider. I know you have a bunch of media coming up because everyone's trying to get a piece of this Hickaway device. But I think I'm the first and so far only doctor or medical physician that's interviewing you.
That's true.
So let's get nerdy. Let's get technical just for a few moments here. We don't want to get too technical, but tell me physiologically and mechanically, number one, what causes hiccups? I know we have viewers all the time ask me, Dr. Mira, what causes hiccups? Now, who better to tell us than a neurologist, intensivist, and the inventor of Hickaway?
It's $1 million question. And still, nobody knows exactly how the hiccups happening, but whatever the scientists and physicians know so far is the hiccups is a reflex starting with sudden spasm of diaphragm. And this sudden spasm of diaphragm can happen with a spicy food, with alcoholic beverage, if somebody has acid reflux disease, or many other things. So this going to send a message to the brain, and the brain going to send a message to our larynx or throat, where we have our vocal cord, we call it glottis. So, and the glottis get closed suddenly, and this shutdown of glottis and is the one that causing the hic, that sound that is very famous for the hiccup. And this is going to be a vicious cycle, go again and again as arc and repeat and repeating. And nobody knows exactly how these two systems combine to each other. But so far, this is what we know about it.
Very good. Now, from the actual mechanics of hiccups to McDonald's to the invention of the device, all jokes aside, we have science that backs this up and supports it. Now, anytime we have a device that is scientifically backed, or we have the research, the medical community gets so excited. So tell me a little bit about the JAMA article, which is one of the leading publications out there worldwide that recently published your study. And correct me if I'm wrong, I think it's the largest hiccup study that's ever been done, involving about 600 patients. And I know you have future plans to develop even more research now. But tell us a little bit about that JAMA article that was published.
Right. So, when I invented this, and then we were looking to see how effective is this device in public. So we started to recruit so we put the announcement, whoever has hiccups and interested to use this device, which is a very simple device, I'm going to show you momentarily. We asked whoever is interested, they can participate. So about more than 600 people from US, Europe, Japan, South America, Asia, everybody participated, and they said, we're interested to test. So these are the people that they get hiccups frequently. So we sent them the device, and they had like 4 months to test it. So our goal was to see how this device they can compare subjectively with the other remedies that they had used in the past. So after 4 months, we collected the data, and then we showed more than 90% of these people, actually, they report the Hikebe is more effective than the home remedies that they used in the past, which more than 90% actually is very good for a device.
I mean, you heard it first here on the Human Condition MD that we have the data and the science to prove that Hikaway is better than some home remedies or what your grandmother or mom might recommend, even though mothers know a lot and grandmothers know a lot. But now you have a simple device. And we're going to hear later from a patient, a firsthand testimonial on how this simple device gave somebody their life back. It really was not only life-changing, but gave this young woman her life back. But on to the next point here, Dr. Seifi, is it available for anybody? In other words, from age 9 to 90, are there any age restrictions here?
Right. So this device actually is available to public, first of all, and they can use it as far as they're able to sip water through a regular straw. So I would say anybody above 1 year old, they can use it, because the infants less than 1 year old, usually they're not able to drink through straw. But the youngest patient actually we had, I wouldn't say patient, the youngest subject that we had that also was participating in that study was 1 year old. And we have the video of that 1 year old. It should be on YouTube. Wow. And the oldest person, we had 90 years old. So there is no age limit as far as they're able to sip the water through straw.
Now, the device can be used from ages 1 to 90. And so our viewers listening, and if you're listening to this worldwide and you want to get your hands on this device for yourself, a loved one, I have to say, I know it's flying off the shelves because hospitals want this device. And TV anchors like myself, we want this device because oftentimes you're caught on camera and you need a quick fix. You don't have time to try other things. And the beauty here is it's non-pharmacologic, fancy word for meaning it's non-medication. So there's no side effects. It's a simple device. It's safe to use, 1 to 90. Where can people purchase this? How can they get their hands on this device?
Okay. So this is that simple device that we name it Hikaway. First of all, it's very simple and it's reusable. So basically, you need to have one and you can use it pretty much forever. Currently, it's available on Amazon, so they can get it from Amazon, and also from the own website, which is hikaway.com. Also, Walmart online, they have it right now, and a couple of other online. But for now, I would say Amazon and hikaway.com is the best place to prepare it. And yeah, it's available since a year ago.
Well, that sounds amazing. It sounds like it's readily available, both Walmart, Amazon, as well as other sites, I'm sure, that have this available. And so if you've listened to this interview, you think this is fascinating, you've heard it from Dr. Seifi, the inventor himself. Now, a lot of people don't know this, but you and I have a personal connection as well.
Yes.
When I myself was just a student, just a neurology resident, luckily our paths had crossed, the stars had aligned, and Dr. Ali Seifi was actually senior to me. He was my neurointensive care fellow, which in the medical world means he was above me and he was my teacher. Now, not only did my class completely admire his teaching skill, we've awarded him teaching awards. He has gone on to receive many awards himself. But Dr. Seifi, so I am forever grateful because you were influential in my life and in my trajectory professionally. And of course, you influenced so many students around the world. As a concluding remark here, tell me, do you have any other inventions up your sleeve, or is there anything else that us students of science, of medicine, of art, anything else we can look forward to, or are you going to keep this a secret?
No, I have actually, I have 3 patents which are right now. So one is this Hickaway. So the other patent I have is a device actually I made that is a calibrator for cooling machines. So as you know, when the patient they have cardiac arrest, usually we cool them for 24 hours with certain special device or machines, you name it. And usually we cool them to like 33 or 35 degrees centigrade for a day and then rewarm them. So these machines, sometimes they don't work properly. Sometimes they overshoot or undershoot the temperature. So I made a calibrator or like a dummy device that we can computerize, program it, and connect to those cooling machine and test and find the problems of that function of those machines. So the other patent, which is already issued, is I made a new treatment for anti-NMDA encephalitis, which I know like most of the audience, they may have heard, and all the neurologists know about it. There are a couple of movies and books and stories about it, which are usually these are young females that they are healthy, but they start to acting bizarre behaviors and become psychotic. And then they found like they have the ovarian tumor that makes antibody against the brain. And the treatment usually is changing the blood plasma or IVIG. But I made a new way of treatments that they can treat them within just 2 or 3 days. And it has been reported and it's very effective.
All right, so Dr. Seifi, a lot of people want to know, and you've told us now how hiccups work. How does the actual Hickaway device work physiologically and mechanically? How does it seems so simple, but how does it actually stop the hiccups?
Very good question. I was thinking if we know exactly how the hiccups happen, we may be able to stop the hiccups. So as I said, hiccups is a vicious cycle, starts with the diaphragm and then go to the phrenic nerve to the brain, and then vagus nerve goes back to the throat to close the glottis. I was hypothetically thinking, what about if I keep these 2 nerves busy at the same time? Then I may be able to stop this arc of vicious cycle between these 2 nerves. Then I was thinking, okay, how can I make these 2 nerves and muscle working at the same time? Then after lots of research and thinking and making prototypes, I found if we suction water, then we need activity of our diaphragm muscle. And this requires activity of phrenic nerve, which is one leg of the hiccups. Then at the same time, if we drink and swallow the water, it requires closure of epiglottis, and that requires activity of the vagus nerve. So this intense suction and swallow activates these 2 nerves at the same time. That was a hypothesis, and the hypothesis came true. So the way that this Hickaway works, because it has a pressure valve in the end here, and this is the mouthpiece. So to drink water through this, the subject actually needs to do more than a regular straw effort to sip the water. So they need kind of more than usual effort and energy. So this more effort requires more activity of the diaphragm, and that drinking the water requires activity of the vagus nerve. And that's why it stops the hiccups.
Thank you so much. Essentially, what you've explained is even though it may appear similar to a straw in shape, really the device flow, that Bernoulli's effect, the physics behind it, then requiring the extra pressure, activating of different nerves or simultaneous nerve activation. You've explained why it works differently than just a simple straw. So thank you for that incredible explanation.
Yeah, and the length and dimension of this tube, we have calculated to generate about negative 100 centimeter of water pressure. So all the sizes and the valve pressure is calculated to impact enough the diaphragm muscle.
Well, it sounds like there's a lot of things in the pipeline which medically, scientifically will continue to further education, development of life-changing therapies. And so that is just so incredible. Thank you so much, Dr. Seifi, for being with us today. Please stop by the studio next time you're in Washington, D.C. And don't forget about us. We look forward to seeing your continued success and progress. Thank you for joining us and telling us all about Hickaway.
So I have very strange hiccups. They sound more like burps. They are very painful. And the only way that I can get rid of them is to use this straw. Nothing else works. So without further ado, I'm going to drink to get rid of them now. Two sips, no hiccups.